Hi, you guys. Welcome back for our daily practice questions. As always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner and I'm the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, one-on-one sessions, Q banks, question analysis sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, y'all know I always like to go over my disclaimer and reminder that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines being tested on the AANP as well as ANCC exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states, when should screening for diabetic retinopathy begin in patients with type 2 diabetes? Is it A, at diagnosis, B, after 1 year of diagnosis, C, at age 40, or D, every 5 years after diagnosis? After diagnosis. Take a moment to tell me what you got in the comments, you guys. All right, so I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what's being asked of you. But here in this scenario, the question is the stem is the question, right? And y'all know the stem of the question is the end of that question, typically with a question mark. So here, because it's a short question in one sentence, that's why I say the stem is the question is the stem. So when should screening for diabetic retinopathy begin in patients with type 2 diabetes? And the best answer is A, at diagnosis. When you confirm a diagnosis of diabetes for a patient, you want to go ahead and do a fundoscopic exam as well to go ahead and gauge if they have any signs of diabetic retinopathy. And sidebar, what's some things that may make you think of this? Things like cotton wool spots, right? So you want to identify this. You also want to ensure that you're advising your diabetic patients to make sure they're getting eye exams annually. And if you are seeing signs of diabetic retinopathy, they definitely need to be following an ophthalmologist every year for these screenings to make sure there's no worsening, etc. Question number 2. Which of the following is a common symptom of hyperglycemia in type 2 diabetes? Is it A, weight gain, B, increased thirst, polydipsia, C, decreased urination, oliguria, or D, low energy levels? And I'm going to read that one more time. Which of the following is a common symptom of hyperglycemia in type 2 diabetes? Is it A, weight gain, B, increased thirst, polydipsia, C, decreased urination, oliguria, or D, low energy levels? Take a moment and tell me what you got, y'all. All right, so here's stem of the question. The question is the stem is the question, right? So it states, which of the following is a common symptom of hyperglycemia in type 2 diabetes? And you should think of the P's, right? So B is your best answer. Increased thirst, aka polydipsia. Remember your 3 P's, right? Your polydipsia, your polyuria. So it wouldn't be oliguria, it'd be polyuria, and your polyphagia, right? So all of the polys, all right? So there's an increased appetite, increased thirst, increased urination, okay? And that's something that you will commonly see patients present with that will also, it may warrant you to proceed with evaluating if they are diabetic or not. Because one of the classic things is because people push aside how thirsty they may be. But when they have to urinate all the time and they're getting up all throughout the night, they're starting to mention this and say like, hey, I don't know what it is, but every hour I'm up and having to go to the bathroom throughout the night, so that polyuria will commonly be that thing that they'll tell you about. But the 3 P's, when they tell you about that polyuria, I'm sure if you ask them about their thirst, etc., they'll say, oh yeah, you're right. But remember, those are common symptoms of hyperglycemia with the type 2 diabetics. Okay. All right. And lastly, question number 3. The nurse practitioner and NP student are discussing metformin. Which of the following statements about metformin is true? Is it A, it is associated with significant weight gain, B, It primarily works by increasing insulin secretion from the pancreas. C, it can cause GI side effects. Or D, it should not be used in patients with a history of heart disease. Take a moment and tell me what you got, you guys. All right, so stem of the question here states, which of the following statements about metformin is true? Right, so of course we're looking for the statement that is correct regarding metformin. The nurse practitioner and NP student are just simply discussing the medication. So we're looking for a true statement. So A is associated with significant weight gain. No, we can eliminate that. It's we can eliminate that one because remember, sulfonylureas are the diabetic medication that is commonly associated with weight gain, not metformin. Um, B, it primarily works by increasing insulin secretion from the pancreas. No, that is not the primary mechanism of metformin. But say you're working through this question, and I know how y'all do. I work with y'all enough, and I tell everybody I process through questions the same way. So with that, you're probably sitting here like, ooh, I don't know, girl. So, okay, I always say hold that to the side, okay? C, it can cause GI side effects. That should really stand out to you to hold that. And then D, it should not be used in patients with a history of heart disease. That's not true, but you can hold it if you just don't know. But one thing I'm pretty sure that you felt very confident on is that it can cause GI side effects. Think about it. What is the thing that you need to teach patients when you start them on metformin? That they may have diarrhea, right? C is your best answer. Do not get tripped up on things that you don't know. And you know, my soapbox to all of y'all, and if you work with me, you know, in our sessions, I'm telling you this backwards and forwards. Trust yourself. You have the knowledge. Don't sit here and start to second guess or change answers just based off of the what ifs. That C stood out to you because you know this information. So apply your knowledge and be confident in what you know. And just because something is worded differently, don't let it make you back away from it, because just because it didn't say diarrhea, you know that it can cause GI side effects. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any other resources that I do offer, feel free to reach out to the Nursing Studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email to the Nursing Studio, the number one, at gmail.com. Now, things that I offer my review book. It's in an ebook, or you can get it in a paperback option. They're both linked in the bio of this channel. If you are someone who prefers to review independently, I do have a self-paced review course designed for family and adult gero for both exams. That's also linked in the bio of this channel. If you need practice questions to complete on your own, my QBank options are linked in the bio of this channel. And if you're looking for me to help you be successful on boards, if you're struggling, if you have taken the exam and you're just points away from passing and you can't figure out what that issue is, book a one-on-one session with me so I can help you to be successful on exams. But y'all know I always say, if you're looking to book any one-on-one sessions with me, be sure that you reach out either by phone, text, or email, because I want to gauge what you truly need so that you're booking the appropriate one-on-one session for your circumstances and where you are. All right. All right, you guys. Y'all know what to do. Make sure y'all meet me back here. Happy studying. Bye, y'all.